graduate work going on across Greater Manchester. So I am Jane Hall and I'm hosting today, and I'm also one of the leads of one of the presentations for a little bit later on. The usual housekeeping, if people could put their microphones on mute unless you're presenting. This session will be recorded and I think you should get the notification bar about that now. You will need the chat box function for question and answer. Just in the interest of time, we're probably not going to do hands up and have people asking, so I'll be monitoring the chat. That should be enabled for everybody. I've managed to do that in the settings. So if there are any problems with that, just let me know within the next minute or so. So the next slide will show our agenda for today, and it's pretty jam-packed. It's a bit like a one-stop shop for a variety of projects going on. So firstly then, I'd just like to introduce Victoria Dickens, who is Chief AHP at the Northern Care Alliance and the lead chair of the AHP Greater Manchester Faculty. And she's going to introduce the background and themes of today for us. So I'll hand over to you, Vicky.
Thanks, Jane, and thanks for everyone for joining us today. So I'm just going to give a quick introduction around the brilliant work that we've been doing across, our AHPs have been doing across GM with respect to the clinical placement expansion projects. So I called my introduction building on foundations. So this is like the start. We've still got loads more work to be done. But as Jane said, this webinar is about sharing what we've done so far, celebrating the achievements and building on this to move forwards. So a bit of context for you all, and some of you will have seen some of this information before, but I always think it's a good reminder of the ask, which should help us focus a little bit. So I think there are probably quite a few AHPs on the call, but for the people who aren't AHPs, you know, we are the third largest professional group in the NHS. We're highly skilled, autonomous, registered professionals who form a key part of delivering care across lots of different settings, such as hospitals, community, housing, justice, education, private and voluntary services. So, you know, some of the areas that we don't traditionally think about for learning environments might be something that we want to think about in the future. Across GM, there's approximately 5,200 AHPs and about 740 AHP support staff that work across GM. So we've got a lot of people that can help us with the work that we're doing. It's about reaching out to them and getting in touch and try and link them into the opportunities that are available for people. Obviously, that's what we've got at the moment. The long-term plan that was published in 2019 predicts the need for an additional 5,000 physios and 2,500 paramedics by 2023. And that's also working with looking at additional dietitians, OTs, podiatrists, and that's just in primary care networks alone. So across the whole of the NHS, the People Plans Workforce Planning team predicted that we'll need approximately 27,000 more AHPs in England over the next 4 years to meet the demand. So, you know, the stuff that we're doing around placement expansion is really important for our future workforce. Can we go to the next slide, please, Imrana? Sorry, let me just click on something here. So why do we need to do this now? So this slide talks a little bit more about some of the challenges that we've got within the workforce. So nationally, we've got challenges with some AHP professions, so particularly around podiatry, prosthetic and orthotics, orthoptists and therapeutic radiography. So we need to do some work around encouraging people to go into those professions. But specifically within GM, we know the current picture talks or tells us that we've got some current challenges around learning environments. And again, we can do more in all professions, but there's, you know, we've got challenges in some second year podiatry placements that are not having enough available at the moment. We've got challenges in diagnostic radiography. We've got some new courses coming on board in GM for dietetics, and we need to look at the learning environments to support those programmes. We've got a bit of a shortfall in OT mental health, and we've currently still got a shortfall on a backlog due to the pandemic around sort of the physiotherapy placements as well. So, you know, we really need to focus on what we are doing for our future workforce. So these are the particular areas of concern at the moment, but as I've just pointed out, we can do more in all areas. So thank you. So I'm not going to tell you a lot of the detail of what we've achieved so far. That's going to follow in the webinar, but there's a few givens that I just want to draw your attention to. So all the expansion that's taken place so far and that will take place in the future is quality assured. So it's not just about increasing numbers, it's about looking at the quality of the learning environments as well. So, and it's really important for that, because, you know, if we want people to apply for jobs and stay in GM once they've finished their training, we want to give them the best experience for learners. I know when I was a student, once I qualified, I thought, where did I have a good time on placement? Where would I want to work? So there's something about providing that experience for learners. But also we've got to meet some standards. So we've got to, it's not just numbers, it is about quality as well. So we've got the standards that are set out by Health Education England and our professional bodies to make sure that when we are giving the students the experience, we are doing it to a high standard. So my final message before I pass on to everybody else, it's really around sort of culture change and using the other enablers within the system to help support this piece of work, you know, so that we're not really, you know, we're not reinventing the wheel, we're learning from each other, and that's part of what today's about. But on my slide here, it just gives a couple of things that I'm personally using in my approach. So, you know, one of the things is sort of taking a step back and just reminding staff that educating others is part of everybody's role. It's not, you know, it's not an add-on, it's not something that we should be choosing to do. It's something that we should all be involved in. There's quite a few other things going on at the moment, especially within the NHS, which can support this as well. So looking at job planning. So I'm saying it is part of everyone's role. It's not an add-on. It should be job planned. People should be given the time to do it to support the learning environments properly. The other thing that is hot topic at the moment is the Enabling Learning Environment Strategy, which was launched across GM probably about 6 weeks ago now. So there's loads of things in there that we can build on and learn from. We want to obviously put that into local implementation. And the main thing is about learning from each other and supporting each other. So I'm going to pass on now to everybody else to share the great work that they've been doing. Thank you very much.
Thank you. I think that really helps set the scene and give the background and the drivers to all of this work. So yes, these projects are all about the how. How are we going to do this? So I've grouped the talks into 2 at a time with Q&A afterwards. So I'll be monitoring the chat for questions. So please do pop them in the box, and we'll review that at the end of every 2. So the first presentation then to kick us off, Claire Moore and Claire Smith from the Northern Care Alliance.
Thanks, Jane. Yes, so good afternoon. Claire and myself have been leading on the NCA CPEP project, which covered 4 AHP groups, which were OT, Physio, Paediatric and Speech and Language Therapy. And our initial sort of funding came through from HE for the CPEP work, and it initially funded us until April this year, but then we've been lucky enough to secure some extra funding through our local learning and development team to sort of continue this work alongside the PEP team until October this year. So our initial bid outlined the sort of aims you can see there, but they were mainly to obtain a 10% increase in placements offers across the NCA, and then a 10% increase in clinical educator numbers to support those, with some other related tasks that were designed about the processes to sort of make sure that these outcomes were sustainable. Next slide, please. So just quite briefly, we managed to do actually better than we expected to. So we actually achieved a 26% increase in placement offers, which equates to an additional 87 learning environments across those 4 professions within the NCA. And we also managed a 12% increase in clinical educators. Not quite an equal percentage, but Claire will talk more about that in a second. And we've also had some positive results with the process side of things as well. So we've managed to implement a standardised approach to placement allocations and sort of monitoring of capacity across all 4 of the professions. And we've been doing work, and it's continuing to address the culture change across the trust as well. Next slide, please. Oh, okay. Yeah, so the next couple of slides are just a bit of a breakdown of those increases a bit further if anybody was interested. So this one's just showing the number of additional placements within each of the professional groups and within each of the care orgs that make up the NCA. And then next slide, please. And then this one, it was just as part of our reporting to HE, they actually asked for the number of placements that have occurred this year or that are planned for next year. And as you can see, the majority of ours have happened this year, with a few still planned for the summer months. And you'll also notice there was a couple of offers that were actually not utilised by universities at the time, but we've with a bit of digging, we've realised that they're more around sort of the specific nature and need of the placement block at that time, and the offers not being the needed speciality. So next slide, please. So yeah, just because our budget for sort of supporting teams with technology or resources was rather limited, we made the decision as a team not to sort of focus on working with teams to consider alternative ways that would require additional resources. So the majority of work we've done has been sort of discussions with teams around capacity and what they could offer, which has had some good results, and we've had a right mix of some teams that have not taken students for years, so haven't sort of been included within our baseline figures, actually offering out placements again and sort of making sure that they do that from now on in. Some teams have just sort of said they will offer more placement blocks for that year compared to what they've sort of going forward compared to what they've done before, and then a few others are jumping on board with the 2-to-1 model and taking 2 students at a time. And all the way through, we're sort of trying to support staff with these changes as best we can. So we've ran webinars to sort of share ideas and sort of put teams together just to make sure that we're sort of showcasing the innovative styles that are happening. And we've created some resources that can help teams to better support their students when they're coming out onto placement. So that's a bit about what we've done, and I'll hand over to Claire Smith now just to sort of discuss reflections and next steps.
Thanks, Claire. Next slide, please. So overall, we feel that the project has been really successful. We exceeded our target increases and have embedded a new streamlined placement process so that the 4 professions that we covered within the project all approach student allocation in the same way and have information in a centralised place. This should aid for better and clearer data collection and planning. And we also feel that this will help to continue to address capacity going forward and make the achievement sustainable for the future. On reflection of the project, we feel that the clinical educators information we did get probably isn't the full story regarding how many educators we do have within the trust, as unfortunately we only got a minimal response to the questionnaires that we sent out to collect this information. We also know from the tables that Claire just shared earlier that the placement increases weren't spread evenly across the NCA. So, and we're aware that some of this is due to the common barriers that I think everyone's facing at the moment, so such as lack of IT equipment, staffing levels, and then the COVID-related stuff like lack of space and social distancing, etc. Just move that over. 1 second. Next slide, please. Lovely. So the next steps of the project are to devise a framework. So Vicky mentioned this before briefly, to embed the education of others in everyone's job role. And it won't just be for undergraduate students like we've covered in this project, but it'll be for all work streams, including T-levels and postgrads, etc. and other work streams as well. We mentioned before about the minimal input for clinical educators' information. So we've been looking at a way of capturing a true picture. So one of the ways we're addressing this is the development of a clinical educators register for each department within the NCA, and we've literally just finished them off this week. So the registers contain the names of all the staff, which team they're in, and then we've highlighted if the member of staff is a clinical educator or not, and when they last did any educators training. And we've got people, nominated people in place now to keep these registers up to date. So they'll update them every quarter, or if they know of any staff movement, they'll update it sooner if needed. And we're going to include the dietitians within the NCA in the scope of the project as well, so tie them into the work that we've been doing. And we're going to continue to support a positive placement culture and hopefully further placement increases, and also continue to try and help reduce some of the placement barriers that we've mentioned before. Next slide, please. Thanks. So we definitely feel that the project has had a positive effect on both learners and the NCA workforce. For learners, there are more available placements across the NCA, and in a lot of teams, there seems to be a more positive and welcoming placement culture. And I think more encouragement than ever for this positivity to spread into all the teams. There's also been the development of resources with help from some of our previous learners actually as well, which is lovely. And these are to help improve the learner induction process and help the learner feel more prepared before the placement and more welcomed on arrival. For the NCA workforce, the new placement process should now be more streamlined and ensure good communication links are open and that data is more easily accessible with less confusion and errors. And we do feel that our work has helped teams to start thinking differently and be open to utilising different placement models. And we now know of one area within the NCA that have set up their own task and finish group off their own back. It's nothing to do with Claire and I. They've done it themselves to discuss different placement models and share ideas. So hopefully that, we feel that hopefully has come off the back of some of this work. So yeah, I think overall we feel that the CPEP work has really started to make a huge impact on teams, staff and learners. And I know Claire and I feel very privileged to have been a part of it all. So thank you very much.
Great, thank you, Claire and Claire. I think, yeah, great to kick off with a project that has exceeded its targets and also touches on a lot of the common themes about, data collection and the process of organising placements and monitoring educator, spreadsheets. So thank you for that. Do we have Vicky Whiteley on the
yes,
call?
I'm here.
Brilliant. So next slide, please. So Vicky is a dietitian from Manchester Foundation Trust, and I will hand over to you to talk about your work.
Thank you. My name is Victoria Whiteley. I'm an advanced clinical practitioner in the Dietetic department at Royal Manchester Children's Hospital. So we had a successful bid to the CPEP funding, and we've looked at developing a novel paediatric placement for dietetic students. So prior to beginning the project, we offered around 150 hours of dietetic placement in the Children's Hospital here in Manchester. So that was 4 2-week placements per year, and it was just a brief introduction to dietetics. So we have looked to develop this novel 12-week paediatric placement in a tertiary paediatric setting, which will increase our sort of placement hours to over 1,500 hours. We've done this in conjunction with Alderhay Children's Hospital, and we'll both provide 4 12-week placements each per year. So when we looked at our objectives, we wanted to develop a placement that would, thinking of the quality side of things, include a range of clinical and non-clinical experiences to enable the pre-reg dietetic students to meet all the competencies outlined by HCPC and the British Dietetic Association. We know from interviewing and surveying the students at university that there were some concerns that perhaps a solely paediatric placement may mean that they didn't meet the same level of competencies that their sort of fellow students would meet on an adult placement, but we've worked very hard to sort of ensure that we're still offering the same sort of range of experiences, and we're quite happy with that. We also looked at developing some pre-placement education with the universities to support the students that then would be coming into the paediatric placement, and we've enhanced their sort of curriculum and also provided some preparatory work for the students that they can complete, and this happens for those entering into sort of adult clinical placements as well, but we've just tailored it to the paediatric speciality. As well, because we've only had very short placements within the Children's Hospital previously, I've worked hard to train the staff within the department to feel confident and competent as being clinical assessors. We've used the support of the universities and also our PEF to be able to do this, and so that our staff can supervise the patients on placement. Next slide, please. So our project has come to an end now. So as I said, we've put significant support into the universities, and currently that's Chester who provide our students, but I've also been in talks with Manchester Metropolitan University and also UCLan, who are moving to provide dietetic sort of undergrad and postgrad courses in the coming year. We've got a package and a sort of a master placement timetable with supporting tutorials and project work to give those opportunities for the students. We've also put provision in for remote working or virtual or home working as required, to be quite adaptable to ensure each of the students has as many opportunities to meet their competencies as possible. And as I said, we've worked hard with the team looking at clinical supervisor roles. We've also developed evaluation and feedback forms to assess our outcomes on placement, ensure that we can continually develop and adjust the placement to meet the needs of the staff within the department and also the students. So we've not actually had students on placement as yet, just because the first placements are due to commence in September 2021. As I said, we'll be looking at that feedback and evaluation from all the staff and students involved to make sure that we can make changes to subsequent placements, but currently we are planning to do 2 12-week placements per year, each with 2 students, but with the potential to increase that further to sort of, rather than 4 students per year, to 6 students per year. And our sort of main aim really is to increase the exposure of dietetic students to paediatric, so hopefully we can support the development of our future paediatric workforce. Thank you.
Brilliant, thank you. I think great to do a bit of a deeper dive into one specific profession in a specialist area within one team to actually see what the planning stages are. Brilliant, thank you. There haven't been any questions in the chat. Well, the one that did pop up had already been answered. I suppose just to echo that point, all of the expansion we're talking about, the key theme is for it to be sustainable, and then we grow on that in the future. So any questions for either of those presenters? Not that I can see. I suppose I just have a quick question for you, Vicky, not being a dietitian myself. How was it received within your team, talking about doing work from home and looking at the non-patient facing aspect? Was there any concern about the marking scheme, and how did the university support that kind of thing?
I mean, I think there's been general concern about having students within the department for a longer period of time. When we have students for 2 weeks at a very early stage of their training, there's, we have very little sort of assessment really. If they come and they're motivated and enthusiastic, they pass that 2-week placement. So to move to actually do an assessment when, myself and many of my colleagues have worked in this department for over 10 years. So it's been many years since we've had students for a longer sort of placement. So that was the initial sort of worry and concern. And then working, I mean, we have many people within the department that have had to work remotely or from home. And we do a lot of our sort of clinical work is sort of virtual now. So we've put in a lot of sort of support around training, and I guess we have to try and see what outcomes there are and address issues that come up and be really flexible to adapt to any problems that may arise. And we've been sort of looking at how other people have worked or other departments have worked to sort of try and take on some of their sort of ideas and suggestions. But yeah.
Right, yes, you put the planning in, yes. Super. Karen, you've got your hand up.
Yeah, hiya. Thanks so much. It's really great to see these presentations and to hear all the developments that have been happening over the last few months. And I was really interested to hear about the task and finish group that have been set up independently. So, colleagues embracing the importance of educating our future workforce. And I just wanted to ask what you felt sort of was the driver for this happening.
I think so. It's a physiotherapy team, and I think obviously this team have done really well with the expansion anyway. They were one of our sort of providers of the biggest increase. So I think they've been open to trying sort of different placement models, synergy models, and different things like that. So I think they've been, I think actually there's someone who's part of the task and finish group who's just commented. So I think they all wanted to share, they're quite a large team. So I think they just all wanted to share ideas, because I think they are all, from what we have found, quite all interested in getting involved and trying these different things. So they've just been really open. And so I think that's been it really. They've wanted to increase and they want to get involved. I don't know if anyone wants to say anything from the task and finish group.
Hi, I'm Gemma, one of the physios in that group. I think it was brought on because about 3 days before placements, the unis reached out and were like, we've got no capacity, can anyone take a 2-to-1? And we all just kind of blindly said, yeah, great, and didn't really know what we were doing. Took these placements on. So I think it was just kind of like to feed back and see, because we know that those models are coming, just to kind of see if we can kind of put a more structured way of doing it in, because we all went in very blind and we all felt the effects of that really strenuously, if you like. So it was more just to kind of get the feels from that one really. So that's why we set that up a little bit independent, just so that we can kind of come in line with what's coming in the new placements and the new models and the ways of working.
Yeah, brilliant. No, thank you so much for your response there. It's just great to see this, this real culture shift as well, which the strategy we've developed in Greater Manchester pushes forward. So thank you for all your work.
Laura, we've got time for you just before we move on quickly.
Thank you. I suppose that just to comment on, so it's fab to hear Gemma and I suppose the team at Salford and others, I'm sure, will follow suit. So, not to give too many spoilers about our presentation coming in a little bit, but we had Greater Manchester wide task and finish groups, specifically around GM Synergy, and we created a number of resources to help support people to set up 2-to-1 placements. So I'm just thinking, there may be, and thinking about, who attended those meetings. Gemma, I know yourself, I think Juliana attended a lot of them, but there may be some resources and things that we have already got that would help you, so you don't need to just like start from scratch and reinvent the wheel. And I know I'd definitely be happy to come and speak at your group, and Jane, if that's needed, going forward. But that there are things that may be of use for you already set up. So
thank you. So our next presenter is Sarah Booth from the University of Salford, and she's going to talk to us about the work within diagnostic radiography expansion.
Thanks, Jane. So hi, everybody. Yeah, as Jane says, my name is Sarah Booth. I'm a lecturer in radiography at the University of Salford. I'm also a bank radiographer still work clinically for a trust in the Northwest. Next slide, please. Thank you. So our project, the Workforce Project, came really off the back of Jane's project, which was the GM CPEP project, which for our region, I actually identified several barriers for sort of partners to increase their numbers of students for diagnostic radiography. So taking that information, the University of Salford, in collaboration with the Christie Foundation Trust, and my colleague Alastair is on the conference today, submitted a bid for funding from HEE to really look at this with sort of a more of a sort of DR focus, really, and that bid was successfully awarded in September of last year, September 2020. So the aims of this project are really to look at our existing processes and practices, both within the university and also with our clinical partners, looking at how best to deploy our students and support them, but also be able to support the practitioners and their tutors who obviously work with our students in the clinical environment, and ultimately to sustain an increase in our capacity for placements for diagnostic radiography in the Greater Manchester region. Next slide, please. Thank you. So at Salford, we offer a 3-year BSc Honours programme. It's a programme that's run very successfully for a number of years. We have 11 partner NHS hospitals, so we site our students across Greater Manchester. We have a placement site in Cheshire and Merseyside, and also one in Lancashire, so it's a broad geographical range. You can see from the table, this is our proposed capacity increase. So we've gone from 55 students 2018-19, 2019 to 62. So the bid was developed on this number of 62. So the bid is based on an increase of 30 additional diagnostic radiography places. So we're aiming for 30 places by the year 2022. So we're going from 62 to 92. So you can see for the last academic year, 2020-21, we actually took 72 students. So some of the capacity has been achieved already, and we're now working towards increasing for 85 and obviously 92. I can't at this moment publish kind of the numbers, and the project is sort of 6 months in, but what I will say is that with the work I've currently undertaken, we have been able to identify additional capacity, but as I say, until I've had it confirmed from the departments, I can't really disclose where we're up to. So hopefully, sorry to be vague. Next slide, please. So how we've done it, so we initially started the project in January of this year, and working really predominantly with the NHS partners to start off with, really to meet with them, understand their departments, get a feel for the facilities they offered, the way that they worked with students, how they were supporting students, identify any barriers, and also to try and address some of the barriers that Jane had picked up from the CPEP project. In addition to that, I've looked at, I've really kind of gone out to private providers and really kind of scoped to see if private providers would come on board to collaborate. And I have to say, these have been very positive conversations. A lot of the private providers understand the workforce situation and are happy to support our students in their learning. So as I say, there's been some very promising conversations with that. So in terms of the scoping exercise, which concluded last month, I've then taken the information that the sites have given us and really kind of looked at alternate ways of placing our students and how we can sort of operate a placement, moving away a little bit from the more of the traditional kind of 9-to-5 model. So our solutions are identified as short-term and long-term. The short-term solutions are things we will implement for September 2021 this year, and the long-term solutions are things that we will develop over the next few years, really, just to try and again increase the capacity, but also to ease some of the pressures of capacity that we've got. So for short-term solutions, really, this is heavily focused on alternate ways of working. So looking at actually students doing extended working days, so working till 8 o'clock of an evening, splitting the week. So we have students working Monday to Saturday. One student does 3 days, long day, and then the other student does the other 3 days. So you're not increasing footfall in the department, which is a big concern from the staff, is having too many students in an area. And what I will say is one of the big factors with the project is to ensure we maintain quality. It isn't about sort of the quantity and what we get out at the end. It's about maintaining the quality of what we're offering. So we're looking at that, and that's on paper is working successfully, and the tutors, I have to say, have been very open to that different way of working, which has been brilliant. Looking at utilising all the relevant clinical areas, particularly in year 1 of the radiography degree. Obviously there's a heavy focus on projectional radiography. We can't place all students for 12 weeks in an x-ray room necessarily, so we do need to look at utilising other clinical areas, things like CT and MRI. Great, they're still interacting with patients and they can hone their patient skills in those areas without having to necessarily understand all the technicalities of those modalities. We are looking at really maximising the use of our community sites and satellite sites. So a number of the NHS providers have satellite and community sites. These have been hit by COVID. A lot of these sites have been shut down. So it's about working with the sites to establish what capacity we've got. I have had obviously a number of conversations with the private sector. I'm currently working what is now 5 sites. It's gone up since I wrote this slide. So I've got 5 sites that I'm working with who will accommodate a student. And so what my intention with the private provider is that we operate a hub and spoke model. So I will buddy a private provider with one NHS site, and then the NHS site will rota a student each week to the private sector. So they get private sector experience alongside NHS experience, and my long-term idea would be that all of the 11 NHS sites have got a private provider that they rotate to. We've also identified some additional learning opportunities. These don't necessarily hugely increase capacity, but certainly broaden the learning opportunities and experiences for the students. So we are collaborating with Royal Manchester Children's Hospital. We've secured placements for all 3 years at the Children's Hospital. We've also identified an increase in PET provision. So students can go into and have a look at some PET imaging and also some cardiac CT, which is obviously a little bit more specialised. So in terms of our long-term solutions, we will continue to increase the portfolio of private provision. We are working alongside our other HEIs, University of Cumbria and Liverpool. We've identified that assessment is a huge sticking point for capacity. It's all very well putting more students into the area, but can we actually assess them? So we're looking at taking sort of the best practices of what we all do and actually forming one common assessment tool. So actually sharing a placement would be easier rather than having 3 different types of assessment mechanisms. The university has hugely invested in the radiography programme at Salford. So the funding of £2.5 million has come from the university, and they have funded an entire new imaging suite. So we're having our existing suite replaced. We're having 2 new DR X-ray rooms, a replacement of our CT scanner. We've got a mammography unit going in. We've bought 5 ultrasound machines, and we've also purchased a mobile X-ray machine as well. So what this means for the students is they've got amazing equipment in an imaging suite environment. We can really deliver some robust simulation activities for the students, allow them to practice and make mistakes in a safe environment. What we will ultimately look to do is actually run that suite as a clinical hub, really, and take live patients and we'll image those patients on the campus. So to be honest, it will work that the university becomes a placement in its own right. So we will be able to take, again, a bit like a hub and spoke, we will take students from each of the providers just to, again, ease capacity or hopefully create a little bit of capacity as well. And we're also pursuing some coaching training. So again, it isn't just about the increase of students, it's about can we support them? And we do need the students, and we do advocate that students take a more of a autonomous approach. And I'm not quite sure that the way we do that is a strength at the moment. So we are looking at doing some coaching training with both our clinical staff and the academic team, so that everybody is kind of supporting students and taking a bit more of a coaching approach and allowing the students to take a little bit more ownership for their learning. Next slide, please. So really our next steps, as I say, we're only 6 months into this, so I'm going to continue to collaborate with our NHS partners to establish opportunities. As I say, we've sort of identified some potential opportunities for this September, so I'm really hopeful that we can achieve certainly the 85. We will obviously carry on with the installation of our new equipment and developing scenarios and simulation exercises to utilise that equipment to the best of our ability. There is quite a lot of paperwork from our professional body, the College of Radiographers, for new placement providers. So there is quite a lot of paperwork. So I'm currently on with getting that paperwork approved. We are exploring the coaching training for staff. We're currently ongoing with that. We'll continue to collaborate the common assessment tool with the other HEIs. That will be quite a long process, and obviously continue to seek collaboration with the new private providers. Next slide, please. So just to conclude then, the impact for the learners is that they'll receive across 3 years broad learning experience. And I think the important thing is how their training reflects the reality of the job that they will do. The hours that they're working reflect what radiographers are required to do. So they will be ready and experienced at undertaking those kind of shifts. They'll have experience of working in a range of modalities and specialist areas, so such as paediatrics. They will have good experience of both the NHS and the private sector. We do know that students do sometimes graduate and go straight into the private sector. So again, it allows students to make an informed choice, but again, it's given just a different experience with different clientele. And they will have also experienced some non-traditional placements really to develop their interdisciplinary skills as well. What it means for the workforce is hopefully obviously to increase the number of graduates. More importantly, as I say, the quality of the graduates are safe, competent and professionals who are ready to, join the workforce and to stay in the workforce and to continue on. All of the graduates will have a range of experience. They should be adaptable, flexible to any clinical environment, and that will support the NHS People Plan. That's it. Thank you very much.
Great, thank you, Sarah. Lots of transferable elements there, and then the longer term diagnostic radiography work in the region is going to be talked about a bit later on. Fab. So taking a slight sidestep now into therapeutic radiography, we've got Alison and Alastair from the Christie.
Thanks for the opportunity to present on our therapeutic radiographer student placement in proton beam therapy. Next slide, please, Imrana. So, as previously described by Victoria, we need to grow our profession of therapeutic radiographers to achieve our growing demand and the cancer plan. Currently, there's 4,500 registered therapeutic radiographers and 14 HCIs in the UK, 10 of which took place in our proton placement, 9 of those being our English HCI partners. Radiotherapy services, such as proton beam therapy, are specialised and highly specialised, commissioned for regional populations by NHS England services. Next slide, please.
Yeah, thanks, Alastair. So the main aim of our project through the CPEP award was clearly to increase capacity of student placements. I think we've had to go for a national award because we recognise that we wanted students nationally to access proton beam therapy, as in Manchester we're the only centre that delivers this clinically for patients in England. And we've also come up with a blended teaching, learning and model utilising a virtual clinical placement as well as an on-site placement matched with Health Education England quality standards. Next slide, please. So our model was a 5-week placement. The students accessed a 2-week virtual classroom that was delivered clinical education through 50 subject matter experts. They then came to Manchester for a 2-week on-site placement and consolidated virtually. Next slide, please. So the project team was put together at the end of September, and on Friday we finished our pilot. So now we're at the point of evaluation. So we'll be just looking at some of the steps through this presentation. Next slide, please.
So we recognise that time was our biggest priority in this project, getting it started. So we established a project board which aligned individual accountabilities but suggested a collective responsibility for our multidisciplinary team consisting of therapeutic radiographers, subject matter experts and colleagues from digital and corporate services at the Christie. Next slide, please, Imrana. So we very quickly recognised that digital programmes were enabling this project. So we leveraged our N365 tenancy, which we have through NHS Digital, to access the MS Teams platform for all of our learners at a national level. But we also recognised that to be inclusive, we needed to consider digital poverty and accessibility in our planning of how we would deliver the placement experience virtually. Next slide, please, Imrana.
So we looked at the clinical curriculum design that was quite unique because we needed to identify what must students gain by going on a proton placement that's really novel and innovative. But not all these students will work in a proton service. So what else should we include? And what else could we include in order to make really mindful and capable practitioners? And within that, how could we deliver that training utilising blended teaching and learning approaches? Next slide, please. We also needed to consider the national curriculums from all the HEIs and the different timing of placements. And would they be interested in this type of placement being a mixed virtual and clinical placement in midst of COVID? Next slide, please. In terms of the actual site visits, we have the additional challenge of COVID and the paediatric checks and balances. So we did lots of work around making sure the patients and the staff and the students were all safe and had a meaningful experience. Next slide, please. As Sarah alluded to, it's really important to ensure that students get good feedback on placements, and assessments is key. So we worked with the British School of Coaching and co-created a coaching framework to ensure that students got full 360 feedback from practitioners, from peers, from self-reflection and from the education team. Next slide, please. We have evaluated this placement to death, really. So we've got lots of measures that we can use now, learning growth being the academic, through to student personal experience through focus group and workforce surveys. Next slide, please. We've also had secondary measures, so we've got involved in lots of things such as creating career ambassadors, getting feedback for repair, and engaging with the prehab agenda in the oncology pathway. So lots of things that perhaps we didn't anticipate that have been great. But I think most importantly, it's really important to hear the student voice. So I'm going to invite Abigail next to talk about her experiences of the programme. I think just as a summary, we have hit 230 weeks of extra placement capacity, and now we're looking at sustainability and options appraisal moving forwards. So we'll hear from Abigail next.
Oh, there's no sound. Imran, have you clicked the button?
I can hear it.
Ah, I can't.
I can hear it as well, Jane.
That just me, not me.
And thank you for your time and listening, allowing us to share our experiences.
Great, thank you, Alison and Alastair. I think we're already starting to see some themes coming out of models of capacity planning and starting to use innovation like TECS, coaching, whilst maintaining the quality. And there's some discussion in the chat about coaching training for educators. There is some regional work going on to develop a digital e-learning coaching resource for all AHPs across Greater Manchester. So that is happening in the background. But are there any questions for those two sets of presenters?
Can I just add, Jane, we commissioned the British School of Coaching and they designed a clinical educators programme and we all attended 3 days training and we have coaching supervision now. So it's a programme that has been endorsed by the ILM. So it's just worth considering a coaching conversation versus an accredited qualification in terms of quality.
Yeah, absolutely. There's loads of resources out there, aren't there? And definitely look within your trust to see what's available as well as the online things. Yeah, I didn't even know there was a British Society of Coaching, so that's good to know. Okay, I think we'll move on to our next set of presenters then. So we have Kay and Liz from the Northern Care Alliance, who are going to talk to us about their multi-professional placement development.
Hi there, yeah, thanks so much for having us. My name's Liz and I've got my colleague Kay. I'm going to be talking initially just about the about the setup of the clinic and how it's running, and then Kay's sort of going to be going in for it from like how it's working and why it's been successful. So a little bit about our clinic. We're a rehabilitation clinic for patients in Salford who are struggling with long COVID. So the initial aim of this, thank you. The initial aim of this clinic was to develop a student-led occupational and physiotherapy clinic on the university campus at Salford to meet the unmet rehab needs of people with long COVID and who weren't aligning with any existing pathways. It was also to increase practice placement capacity through an efficient, flexible and high quality service. And it was to look at exploring new ways of looking at clinical supervision model that is multi-professional, increases placement capacity, and to provide a high quality learning environment for level 4, 5, 6 and 7, so pre-reg patients for occupational therapy and physio students. Next slide, please. The initial bid was to have 12 students each for both physiotherapy and occupational therapy. To date, we're actually in the middle of our 3rd cohort of students. So I'm having 6 physio students, Kay's having 6 OT students, big variety of years, so it could be 1st, 2nd and 3rd years. The estimated prediction of what we should be getting will, if our placements go back to back, so most students are on 5 to 6 week placements, which are rolling placements which just go back to back. So if we continue with how we are doing with our rolling placements, then we should be doing 8 placements in total, which will be 16 students per profession, so 32 in total. Next slide, please. So the way that we're doing this is a 2-to-1 model in a teaching clinic. So like I said, we both take on 2 students at a time. It's also a student-led with service development and running of the clinic. So the students have been quite heavily involved in some of the things that we've been doing and the service development that we've done, which Kay is going to go on to. Next slide, please. So, so far, we feel the 2-to-1 model has been successful. We've had positive patient and student feedback. We've actually got a couple of students here who are going to be feeding back after both me and Kay have finished. From an educator point of view, having 2 students isn't really any different to having 1. In some ways, it's actually easier having 2 students, because when you're busy, the students can be together, they can work together, learn from each other. Plus as well, because we have multidisciplinary OT and physio students, they're able to learn from each other and they're working together quite a lot, which is nice to see. The 6-month evaluation for this clinic is due this month to review the business case for the current predicted service demands and ongoing delivery of the clinic. So I'm going to hand over to Kay.
Thank you. Next slide, please. So just looking at the impact on the learners of the workforce. So firstly, starting with the learners, the students. So some of the positives that have come from this. So starting firstly with the peer support and the learning. and the interprofessional and collaborative learning. We have 4 students on placement at any one time, so there's 2 OT, 2 physio. So some of the positives are that it increases the confidence levels when they're with one of the peers, brings them out of the shell. They get to work together and share ideas. They're using mirroring and role play to develop the skills. So in spare time or during DNAs, they can practice the clinical skills on each other, practice assessment skills with each other and interventions. They get a lot of team building work, MDT working, learning about each other's profession, and they're also providing input into future students. So working on learning resources, welcome packs, how to make the placement better for future students. Also, as a result of the placement, they're gaining more clinical skills and knowledge. They're getting experience of a new and evolving area of practice. As we all know, COVID is becoming more prevalent in current practice. So students now are going to be encountering this as they go forward and qualify. So they're getting really good assessment skills, comprehensive and holistic assessments, a lot of complex patients with lots and lots of symptoms. So the learning interventions around managing symptoms that are common with a lot of other different conditions, such as fatigue, anxiety, breathlessness, disturbed sleep. Also, soon we're going to be doing a virtual management programme, so the students will be benefiting from that because they were developing their presentation skills. Also, they're getting an increased knowledge of the scope of OT and physio roles. So some physio students and some OT students have never worked with the other profession, so they're learning more about each profession. As the patients are complex, many different symptoms, learning what we can and can't manage, getting knowledge of all the other services that are around Salford, the referral pathways, the criteria. Also, they're getting experience setting up a new service, doing all service development research skills that they might not necessarily get a chance to do on another placement, on a traditional placement. They're getting a chance to develop the non-clinical skills, transferable skills, communication skills, seeing what goes on behind the scenes, setting up a new service, doing admin, taking telephone calls, greeting patients, doing COVID pre-screening. Also, they're seeing different policies and procedures that are in place at the clinic and seeing like sort of why the reasoning why them policies are put into place, such as emergency procedures and infection control and cleaning the clinic. Also, they get a chance to work with other members of the MDT. We also work at the long COVID assessment clinic with the GP and the nurse, so they get a chance to shadow those. And then they get to see a medical and a rehabilitation approach. Next slide, please. The impact on the workforce. So obviously, because there's only 2 of us at the moment, an OT and a physio, we're getting a lot of support from the students with setting up a new service, continuous service development, because there's always students on hand doing researching evidence bases, setting up new patient interventions, the supporting in designing and setting up resources. We didn't have many resources when we started because it's a new area of practice, so that's been really useful in getting them to help with that. They've been helping us with admin tasks, so answering the phone. We're not always on hand to answer the phone, greet patients, clean the clinic, etc. when we're with patients, so they help with that. They've, again, like I said before, they've supported us with developing future student resources, so giving feedback on how to improve the placement, developing a welcome pack and tips on what the next students should be reading up on. We have the ability now to offer increased placement opportunities. The students also, because especially second, third years, they've been on, especially OT, have been on physical and mental health placements. A lot of the symptoms like anxiety and low mood that are prevalent with this client group, they're bringing a lot of experience for us to help our patients. And also it's giving me and Liz knowledge of new creative and sort of non-traditional ways to manage student placements, which will help us. We're both on secondment, so we can use some of these skills when we go back to our other practice areas. So it's maximising our time, the service provision and the student learning. And now on the next slides, I've just got a few quick examples of some of the work the students have been doing. So in the first week of placement, we get them to research as much as they can about long COVID because it's new, and we want them to know as much as they can about it. There's evidence coming out daily, so we get them to prepare a poster and then We put the posters on the clinic walls because with long COVID, there's not very many promotional things around for us to advertise the service. Next slide. So yes, these are just some more posters. So we get them to do them on long COVID and on some of the common symptoms that people are getting with long COVID, such as brain fog and fatigue. So these are two of the posters they've done on that. Next slide. And then we've also, students also tend to work on a project alongside seeing patients. This patient clinic is busy, but we do get quite a lot of DNAs, so they're working on projects in between. So, for example, some here they've done relaxation therapy for long COVID, and the student actually presented this to a group of patients. Same with the sleep hygiene workshop, we presented that to a small group of patients. And then they also get a chance to use the different models of practice like CMOP, MOHO, COWA model, PEO model, and how that fits in with patients with long COVID. Next slide. And also our first students, they didn't really sort of interact with the physio students, and they thought that it would be useful for students going forward to do more work with the physio students. So they designed a team building session that they can do in the first weeks that they all start. So they do a team building activity and then they discuss ways that they think the placement is going to go, what they think long COVID is, what they think the role of OT and physio is, and then their expectations. And then at the end of placement, they can compare as to what they thought the placement was going to be to what it actually was. And also we're working towards having a sort of weekly or every 2 weeks, the students all getting together just as a sort of peer supervision session. And now we've got some students actually just going to feed back to you quickly about what their perspective. Next slide.
There we go. Good afternoon, everyone. My name is Jasper. I'm one of the student physiotherapists. And during my first week of placement, I was the only student within the clinic. I had a chance to see how the clinic worked in that way. One of the good things is that you are on a one-to-one basis with the clinical educator, and you get to learn from this perspective, such as developing professionalism and data protection protocols that you wouldn't really get while you're at uni. Now, comparing that to the second week of placement, now there's more students, there's 2 OTs and 2 physiotherapy students, and there's a big difference from first week. It was like night and day. You saw more of what the teaching clinic can do. There was more interaction with the students. Therefore, you get more feedback on how you are doing. You have more input from different, healthcare professionals. You get to practice more and you do more role play on your assessment and the treatment techniques. And also you get more exposure, making it a better learning environment for everyone as well.
Hi, good afternoon, everyone. My name is Lena. I'm one of the occupational therapy students in this clinic. And one of the roles of the students here is to work on the surface and develop the surface through projects. And one of the projects that I'm working on is return to work after COVID. And the other occupational therapy student is working on anxiety and how patients with long COVID could be able to manage anxiety. And just being with other students on this placement made me realize how it's a good opportunity for us to just practice things and learn from each other and be there for each other if we needed any advice or support. And it's just in this clinic, it's nice to see the OT and physio working together and just putting their input with long COVID patients. And yeah.
Okay, thank you.
That's us. Thank you.
Brilliant. Thank you, Kay and Liz, and a special thank you to Jasper and Lena. That was brilliant. So we will move on to Deborah O'Connor from Manchester Metropolitan University, and then I'll collate those Q&A for both presentations after that. Deb, it's over to you.
Thanks, Jane. Good afternoon, everybody. My name is Deborah O'Connor. I'm the lead for work-based learning and employability at Manchester Metropolitan University in the Faculty of Health, Psychology and Social Care. And I'm here to talk to you very briefly this afternoon about our project that enhanced our physiotherapy and speech and language therapy learning environments within the actual university themselves. Just some background and context, and I'm very aware that Vicky covered some of this at the beginning, but I think it's always useful for us to remember why we're here and what the purpose of this this project was particularly about. We're always going to have to try and meet those drivers around workforce supply and demand, around retention and development of our staff, around transformation of the workforce. And in response to that, as a higher education institution, we have to meet those demands and needs by providing additional education for up to 5,000 AHP nurses and midwives in the 2020-2021 cycle. Now, to do that, we've got to ensure that we've got sufficient learning environments to be able to actually give our students a quality learning experience throughout the whole of the duration of study. So there was 10 million investment in the clinical placement expansion monies, and we did have an increase in student numbers across all our programmes, but particularly on our physiotherapy undergraduate programmes, 65% increase in numbers from 2019-20 intake. So we were very aware as an organisation that we were going to have to do something quite significant to support our trust colleagues and our PIVOs in order to ensure that we've got sufficient learning environments for those students. Now, in addition to that, as I'm sure you're all very aware, closures of particular departments, redeployment of staff, and obviously social distancing constraints also meant that we had quite considerable changes to our capacity across all of our professions, but particularly in that first wave within our AHPs. And that did mean that we were really struggling as well with the catch-up and the recovery placements. So we were trying to think of innovative ways to how we could address and deal with that situation. So our initial bid was to provide 216 physiotherapy students and 71 speech and language therapy students with a virtual simulated placement opportunity, which would give us a total of 287 placement weeks across the two professions. And we were awarded 50,000 from Health Education England last summer to deliver that expansion in this academic year. Next slide, please. So our solution was to utilise something that we already had, and that is our Burley Place virtual online learning environment. Now, this has been developed through our interprofessional education project, and was really something that we had already in the background, but really in its infancy in terms of how we could utilise this as a placement opportunity or as a learning environment opportunity for our students. This is housed on an internet-based platform. It's not an MMU platform, it's an actually external facing platform, so it can be accessed out with the university, which was important to us because we do want to be able to work collaboratively with partners and be able to look at how we can share this platform more widely. Next slide, please, Imrana. So we created a series of scenario-based activities which allowed the students to immerse themselves in a 5-day interactive virtual placement. And the placement was based around clinical areas such as hospital-based care. There was an outpatient clinic built into the system. There was intermediate care activities, and the students had a series of core themes that they had to complete across the 5 days around communication, team working, professionalism, multi-professional learning and education. And there were case-based scenarios with cases built around educators, clinical educators, but also scenarios around particular patients that they would cover through that 5-day journey. Next slide, please, Imrana. So in terms of what we achieved, we had a very short time window to deliver on this. Our first set of students had to do their recovery in January of this year. So we only had from September to January to build this additionality into the online platform. And we managed to get 115 students through that first cohort on the week commencing the 25th of January. And then we used the feedback from that initial cohort of students who were not built into our original bid to build and develop and shape our online offer further for our additional students. In March, we delivered the virtual placement to 74 speech and language therapy first year students who'd lost their school placement hours. In the week commencing the 22nd of March, our MSc pre-reg physiotherapy first year students did their observational 1-week placement, which was 39 students. And then in the 17th of May, our biggest cohort of our first year learners in the physiotherapy BSc programme, 171 students. That gave us in total across this academic year 325 physiotherapy students who recovered 24 hours of effort, which is what their observational placement would normally be, which equated to 7,800 placement hours, and 74 speech and language therapy students, which equated to 1,776 placement hours. So in total, 399 students and 9,500 placement hours. Next slide, please, Imrana. Just some feedback from the students. I would have loved to have a couple of them here to talk to you today, but unfortunately nobody was available. But we have got some written feedback from our evaluation, and that just gives you a couple of the quotes that we've pulled from that. So they did like the variety that we offered, and the fact that there was written article pieces, there was video based and interactive scenarios that they could interact with, which gave them a more blended learning approach. They felt the scenarios realistic and logical. They were questioned so that they had the opportunity to reflect, and that we gave them lots of useful information. They found the content very informative, and they felt that they learned a lot about professional behaviour and what placement or the learning environments would actually look like. And I think the last one for me is the most powerful. I feel ready now. I wasn't prepared before. And if anything, that observational placement for the physiotherapy students was all about that preparedness and giving them the opportunity to see what is expected of them. And whilst it's wonderful to be able to do that in a clinical environment, we were very conscious that actually that strain on the system for those observational learners was taking placement capacity away from our students who needed assessed placements, who were trying to recover hours at the end of the programme. And now we can give them that preparedness in-house and put them in a situation where when they go out on their first assessed learning experience, they're ready to come and be with you on placement. Last slide, please, Amrana. Just in terms of our next steps, currently we're undergoing our formal evaluation of all the cohorts and pulling together a report and dealing with what we want to do in terms of building and enhancing further. We're working with our e-learning developers to produce more interactivity, video and audio content within the platform, looking at what we've got in terms of enhancing it to make sure that we have the best possible student experience. And we are hoping to then try and use this resource within our other professional programmes of nursing, social work, and when our dietetic students start with us in January next year. And we do want to work with other HEIs as well. We've already started to have conversations with Bolton and also the University of Salford. We want to be able to see if we can help support our local HEIs to also have the opportunity to engage with us on this this journey, because it's certainly very sustainable. I've noticed Andrea's comment in the chat, and it absolutely is for us a sustainable resource going forward, and our students will no longer go out into learning environments to have their observational placement. They will do that in-house with us at the university. Last slide, please, Imrana. Just a couple of thank yous, really. I was part of the team that put the bid together, but I didn't do any of the work. I can't take any credit for that. So just a big thank you to those that did, Professor Kirsten Jack, Joe Nicholson and Joe Ashman, who led the project. Our e-learning developers, we could not have done this without them. They are wonderful. But to our learners, who absolutely accepted and embraced new ways of working with very little question or challenge, and to everybody who's listened today, thank you very much.
Great, thank you, Deborah. Some really impressive numbers there and great feedback. So question-wise, there was a question from Gemma for Kay and Liz about your paperwork and marking on the 2-to-1 model. How have you found the paperwork and supervision sessions of the 2-to-1 model?
Initially, when you first did it, it was like, oh God, I mean, it is double the work, to be honest, because you are having to do two students in the PAR document. You know, you want to do it properly for the student. It's got to be fed back properly. You don't want to kind of whiz through for it. So it is double the time in terms of completing it. And obviously when you're doing the supervision with them, but you just, after the first one, you just factor it in now. So it's not really a problem. And also the more you do, the quicker you get at it. So in that respect, my time has come down.
Yeah, it's similar to what Liz says. When you start off, it's difficult, but then as you go on, it becomes easier. Also, as well, sometimes only the first year OTs are on PAR at the moment. So I'm using the old learning agreement, so where we do a weekly supervision. But if there's nothing sort of confidential or any issues to discuss, you can do the supervision in like a small group. Unless I would do it individually if there was something that needed to be discussed about development. So there's ways around making it easier. But like Liz said, once you've done them a few times, it gets easier. You know what to write, and you can revert back to your old ones for ideas and just sort of pointers of what you need to write and things like that.
Thank you. I would echo that. We, in our presentation, we're going to touch briefly on our leadership placements, and I would say the same thing. You know, you learn as you go along. And any other questions before we move on? No, lots of good comments in the chat though. Okay, so I believe it is myself and Laura up next to talk about the Greater Manchester AHP CPEP project. So yes, I was one of the co-leads on this along with Laura. Just let her say hello.
Hi everyone. Yeah, so I'm Laura Hammond, and yeah, I was one of the AHP GM placement leads.
And so our bid was hosted by the Greater Manchester Project Management Office within MFT, and our aim was to create 100 additional learning environments across 7 AHPs all across Greater Manchester. And you can see there the 7 AHP professions that were included. Our main 2 mechanisms to achieve this were outlined as TECS, so Technology Enabled Care Services, and GM Synergy, which for those of you who haven't already heard, it's a coaching model and alternative supervision model that's been very successful in the nursing profession. So we were asked to focus particularly on podiatry and diagnostic radiography because of the known challenges with placement capacity in those areas, and all of the expansion had the key principle of being sustainable so that it could be used year on year. So a bit of a deeper dive into what is TECS and what is Synergy. So when you look up the definition of TECS, it will talk about telehealth, teleconsultations, telecoaching. Basically, it's where there is a digital replacement for a traditional face-to-face intervention. And that could be communicating with patients or between healthcare professionals. So what immediately might spring to mind is virtual consultations or use of the really innovative technology like mixed reality headsets, and it certainly is that. But within our expansion, a lot of the procurement of equipment has been laptops and remote workstations to enable learners to work from home and do remote shadowing and access clinical systems remotely so that the barrier of space is taken away. And certainly when there's other placement content that's maybe more project-based, it can facilitate information gathering, coaching, education together, and digital feedback and document sharing. So as well as there being a variety of what you can use within TECS, it's how you apply it as well and how much of it within the learning environment. There's a lot of variety for. So GM Synergy, like I said, it's an alternative supervision model with 3 key principles. The first, having coaching conversations to really facilitate that independent problem-solving nature of what the learners are doing. Next is peer learning, so from each other and with each other. So that could be as part of a model like 2-to-1, 4-to-1, or planning group sessions of the same profession or multi-professional. And including learners in service delivery. So adapting the content of your placement to include more projects, more transferable skills and alternatives to patient facing. And on the right there, there's just a whole list of ways that you can do that. And again, incorporating as much or as little as you want within your individual learning environment.
So a little bit about what we did and how we achieved it. So myself and Jane came into post in November it was, and as Jane mentioned, we were given the target of 100 additional learning environments to set up. And you can see in the bottom corner here that we actually, you know, and bearing in mind at the time of this, when we started, it was the beginning of November, we were just in Greater Manchester, I think, what, wave 2 as it was classed. And it was an extremely busy time for everybody with huge pressures on services. So, you know, at one point, I think it was our day 2, is, you know, are we even going to be able to achieve this? Does it even feel right to be asking people to do more? And I think, you know, it's testament to the AHPs across Greater Manchester that, you know, that we were not only able to achieve our 100, but we were able to exceed it. So there's huge appetite out there to, you know, to support the future workforce and think about how to do things differently. So you can see by our professional breakdown that there was a large proportion within the physiotherapy profession, And but even and I know, you know, some of the physiotherapy lecturers on the call will say, you know, that still even wasn't enough. There was still a huge shortfall in physiotherapy numbers. And we mentioned that we were asked to specifically try and focus on podiatry and diagnostic radiography, and we didn't achieve any diagnostic radiography placements within our CPEP target. But you know, for other there is multiple reasons for that. But there, you know, there are other projects, as we've heard, around specifically focusing on that. And I think if we're to have a reflection on our project, it would be that perhaps, you know, for future reference, you know, being a little bit more focused and profession specific could be a way to go forward. Out of the 116 capacity, 63 of those have already happened within up until March, and then 53 are for the next, so starting from September for the next academic year. And for each placement that was offered, we did have money to offer them. There was approximately £1,300 per placement, which has been used to buy, you know, remote workstations, coaching training, simulation equipment, and in total it equates to around 30,000 hours of practice education. And a bit, you know, how did we do it? You know, it's lots of engagement with stakeholders. I think I mentioned this earlier. We set up really early in it when we started a number of task and finish groups, a specific synergy and a TECS task and finish group. And you know, those were really kind of like the kind of a bit of a work, you know, real workforce, where we had a number of people that were interested in either they were part of our 116 numbers, or other people just interested in it. And we created resources, guides. We've got a catalogue on the Learning Hub, and it's been really about sharing examples and just kind of hopefully, you know, inspiring people. But even listening today, you know, people on the call, that's still, you know, there's still plenty of people that perhaps weren't engaged in that. So there's still lots more work to do. And we're going to talk a little bit in a couple of minutes around our learners. So we thought, well, we need to lead by example here. So we have welcomed 6 physiotherapy learners since February with us on fully virtual leadership project-based placements with us, which has been an amazing experience. And just as we're coming to the end of the project now, you know, it's around the reporting, that accountability of what we've spent, the money was spent on, and what's happening, and that sustainability planning. So, you know, it's great to hear about, you know, and see how many PEFs are on the call, because, you know, these people that, you know, they're in post, this is the kind of the absolute key to that sustainability, and, you know, thinking about, you know, what to go, you know, when for future CPEP projects perhaps. Next slide, please.
So we have had some challenges and similar, you know, conversations along the way about these themes. So one particular one's about clinical hours, and that anything not to do with a patient won't count. It absolutely will count towards those clinical hours that are set by the professional bodies. They're all supportive of innovation, and you know, it's part of the culture change, and the terminology we use should be more about practice-based learning to allow that flexibility of what is in the content of clinical hours. Obviously, we're all busy as clinicians, but learning and education is everybody's responsibility, and we should prioritise it. You look to use resources and toolkits that are already available, so you're not having to spend a lot of time planning and creating new things. And one concern has been that students won't be ready for qualified roles. I personally feel that we're, you know, by giving them innovative opportunities, we're making them stand out. We're making them, you know, ready for that, being that qualified professional and becoming a more holistic professional, and the universities will absolutely be looking at that experience profile and you know, to support that qualification. And next is just an example of us sort of practicing what we preach, and we love this slide because it really, you know, showcases what we've done in becoming educators for leadership placements within our CPEP project. And you've just got a bit of an idea there of the kinds of tasks that our learners have been doing. We've had them two at a time to reinforce using synergy and peer support, and we've got a soundbite, just a 30-second one from one of our learners, Laura, which I hope will play now.
I could hear that, Jane, again. I think there's something wrong with yours.
There's a gremlin in the system. But no, we've thoroughly enjoyed having learners with us, and you know, we get a lot of questions about marking as well, and adapting anything that has a patient focus within the marking scheme and adapting it to, you know, the project work. And absolutely, it's just being flexible about, you know, instead of information gathering regarding a patient assessment, it's information gathering for the project and the project planning, you know, and exchanging evaluation of treatments to evaluating data and looking at next steps of the work that they're planning. So that you know, we learned as we went along with that, but the universities were certainly supportive. And then our final slide just talks about sort of the impacts that we've made. Obviously, we've achieved or overachieved our target. So those 116 placements will be sustainable, and we're hoping that that will create examples and inspiration for other people. But this is certainly just the beginning of this kind of work. You know, we want everybody to you know, have an awareness of it. And I think everybody, you know, the audience here will have a role in that, no matter what you know, direct role you're in. So I suppose I just want people to think to themselves, what could you do in your role to make an impact and to carry these messages forwards? So that is our conclusion. Now, I know, apologies that we are going to go over time a little bit, but I will now hand over to Carol Cunningham from Cheshire and Merseyside Radiology Network. Thank you for being patient, Carol, and going at the end. I'll hand over to you now.
Thank you, and hello everybody. Thanks for asking me along, and I hope I'll explain why somebody from Cheshire and Mersey Radiology Network's here today. Next slide, please. I'm actually going to talk a little bit broader about the challenges facing diagnostic radiography, and you know, we have been working with Jane and Sarah to a certain extent, and I'm glad it's fantastic to hear the work that's going on in all the AHP professions and the numbers that you've actually achieved so far. I think that diagnostic radiography is posing a little bit more of a challenge, and I do applaud Sarah for the progress she's made in Greater Manchester. So there's a few of the challenges. The NHS longer term plans came up with a strategy for imaging, and that services should be delivered differently, and by 2023 they should be delivered in networks. And that's where Cheshire and Mersey have actually been quite a long way along this road, because we've had a shared digital platform for quite a few years now. So we are able to work together and send images. We don't need to send images around because they're visible all across. Our other partners in the northwest, that's Greater Mersey and Lancs and South Cumbria, are in the process of actually developing their imaging networks at this stage. But myself and my colleague Jill Holroyd were approached initially by HEE, and then NHS England thought it was such a good idea to work on a regional workforce plan. So we've drawn up a strategy and are in the process of developing an implementation plan now. So along came COVID, and it really did shine a spotlight on imaging. There's a little bit of a Cinderella profession that, you know, most patients are going to go through imaging, and compared to other sort of developed countries, we are way behind in the number of pieces of equipment that we have compared to our population. So the government did put a lot of money into additional equipment over the pandemic, but the big problem was we didn't have the staff to run that. You might have heard of Professor Sir Mike Richards, who is an oncologist actually, who was asked to review diagnostic services. So that was imaging, pathology, endoscopy and physiological measurement, and how any changes could be made to improve that. He had a delay through the pandemic to sort of take on board what had happened and whether things could be improved there, and came up with his paper or his recommendations on how recovery diagnostics and recovery and renewal. So could we just go back one slide, please? Thank you. He put it, you know, he predicted that CT scanning will double over the next 5 years, and other services alongside. So he came up with recommendations for some quite significant increases in posts for diagnostic radiographers, radiologists and assistant practitioners. And really, when we break that down to the northwest, I think we reckon that means about 10 additional places for radiographers per trust across the northwest per year. He also recommended that there should be radical change in how services are delivered. So acute services should be separated from elective. So it's actually in the initial stages of developing community diagnostic hubs across the whole country now. So the early adopters are actually starting this month, to be honest. The intention is that there will be a range of diagnostic services provided in these hubs, and it will separate the patients from acute and emergency measures. And this is actually what happened as a natural process for trusts that had more than one site. During the pandemic, they were able to keep one hot site and a cold site. Next slide, please. Just a quick reminder of where we are in Cheshire and Merseyside. And next one, please. Okay, so as a network, this is the sort of thing that we are tackling. We're fortunate that we do have a national data collection for imaging every year. It's happened for the last 3 years. It's a huge piece of work, but it has given us a robust set of data on imaging workforce, on the assets that they have, and budgets, and how much is spent with the private sector, etc. So that is giving us a good basis to work from. We're talking about joint procurement of equipment, that's purchasing power by doing it together. We're looking at raising quality standards, transforming how services are delivered, and in particular cancer pathways, but also maximising the use of digital equipment. So as I mentioned, our shared PACS, which I think is in now in Greater Manchester, which gives great advantages for patients moving around the area. But also a big piece is the workforce. Next slide, please. So during and following on from the pandemic, an imaging cell was developed for the Northwest. So that's the 3 areas that I mentioned: Lancs and South Cumbria, Cheshire and Mersey, and Greater Manchester. And they meet weekly with a medical chair and a lead, and from each area they'll have a lead clinician and a subject matter expert. So they together discuss how things can recover and move forward. Thank you. Next slide, please. So the plan was they would have 2 SMEs, that's Jill Holroyd and myself, working with all our colleagues across the Northwest. We use the data that I mentioned from the National Imaging Data Collection. Slight little hitches there because the data is actually owned by NHS England and is primarily collected to go into the model hospital, and so it's primarily to compare one trust with another, so not collected for the purpose that we wanted to use it for. We've been working with Health Education England and their data analysts, so we had to go through a process of getting agreement that we could use that data and go get to the raw data so that we can use it how we need to do it. We've also been working with the HEIs that provide radiography training. There are only 3 in the Northwest, that's Salford, University of Cumbria and University of Liverpool. And it's great because they are actually working together. They're working together, so they're not all providing the same courses. And we're talking about coordinating and perhaps having more than one exit points through the year, so you don't get your students all coming out at the same time, and then if they move on somewhere you've got to wait another 12 months before you can fill those initial posts again. We've been able to form what we call the DRAD-WAG, which is the Diagnostic Radiography Workforce Action Group. So that's got a lot of all the radiology service managers from the Northwest. We've got the HEIs, we've got the health education workforce planners, the cancer workforce planners, and we link in with the AHP faculties and the other AHP leads. And we also do link in with quite closely with the Society of Radiographers. So the priorities coming out are what you'd expect really, recruitment and retention, the cross-site working, so as well as the digital solutions I've mentioned, we are keen to adopt the digital staff passport as well, so that will give more freedoms for staff to work across different trusts. Also looking at skill mix, as you notice, the recommendation was that there be a lot more assistant practitioners, so that they traditionally are taking on roles in plain film imaging mostly, but they are always going to need supervision, so there is a limit to how many numbers there, and there are actually a limit to how much education there is available for them as well. Next slide, please. So we had a task and finish group for our DRAD WAG, and this is basically what came out. Aware that the BSc for Diagnostic Radiography, which derived from a diploma initially, probably hasn't changed in the past 20-30 years. We had a look really as to how appropriate it was to what we need in a radiographer coming out of that education at the end today. So there is a high emphasis on the amount of plain film imaging they do at the moment, and it was felt unanimously that that wasn't as necessary, and that the students should be taught a lot more of CT. I should point out that because imaging and the number of modalities has expanded so much, students will get a taster of each of these modalities through their training, but can't be expected to be proficient in them at the end. So we knew that that there's going to be need to be a greater emphasis on the preceptorship and actually people coming out with a base with their education, but then being further educated to suit the role that they go into. So in exactly the same way that Jane and Sarah have been talking about, we've been talking about, we agreed that the scope of clinical placements needed to change. So we are bound a little bit by physical environment, which is a great limiter for the number of students we can have on placement. So leadership, looking at what happens in the finance department, HR department, are students aware of risk, of how complaints are dealt with, all this sort of thing. But that also takes a lot of coordination, which we don't have a huge amount of posts that would actually coordinate. We tend to have one clinical tutor in a department. So we thought that we really could do with some additional pastoral support and practice educators. As Sarah mentioned, working with the independent sector, they're very keen to increase the recruitment pool as well, because it means that there are more people for them to employ as well. And also we felt that it would be useful if we could coordinate placements across a network or a region rather than just per trust. Thank you. Next slide, please. This is just a little bit of beyond. This is actually more a little bit of creative thinking for postgraduate training as well, because there have been opportunities to bid for funds from HEE, and we felt that there was a great need for CPD. There's a lot of money coming out to train reporting radiographers, but really they need to have support in the department, and they need the opportunity to build up their confidence, because you can imagine it is a responsibility if you're producing a report that is then acted on, and if you're not quite right, you could have a huge impact on you if there's an issue with it. So a lot of the CPD is around giving an academy environment for these reporters, a classroom environment where they can gain their confidence in the reporting. And also, because of the huge demand for CT and MR scanning, CPD units are being built up to give people the basic learning for these that they can't always gain within the work environment. And there is also just a pilot starting at Liverpool University for an MSc pre-registration in diagnostic radiography, aimed at people who have a degree in another science subject to spend 2 years to become a diagnostic radiographer. So it's great to hear all the creative thinking, and I think that's what we need really to be able to increase our numbers across the board in AHP land. I think that was it. So next, yes, we're away.
Thank you, Carol. Great to hear what's going on at a regional level. And like you say, certainly diagnostic radiography is a profession that we struggles. We have to think about a little bit differently. So thank you. Any questions, comments for any of the speakers who are still on the call? I know it was ambitious to pack in as much as we did, but I think worth it because of the variety that we've had. I think there's been something for everybody today to take away. I can't see any hands up or comments. I will make this recording available, and I've got all of your attendee names and emails, so I'll let you know how that's going to be posted. One of the main places might be the Health Education England Learning Hub. That's our main catalogue for resources at the moment, both written and web links. So really, that brings us to a close. Thank you for your patience. I can see comments already saying thank you and good presentations. I agree. Thank you to everyone who's presented today. And it's done what it says on the tin. It's been a great celebration event. So yeah, I will leave it there. Thank you, everyone.
Thank you.